Thank you for watching the video. This is YouTube Medical University. Today we're talking about shingles. It's said that 1 in 3 people will get shingles by the age of 80, and the symptoms can be very painful, and in some cases people may experience nerve pain that can last for 1 or even 2 years. And it's not widely known, but shingles can also make it harder to see or hear, and can even cause facial paralysis. Such serious complications actually do exist. In fact, if these complications are detected early, or if you know about the types of shingles that require special attention, you can go to the right hospital and get treatment, which can lower the risk of complications. So in this video, I will cover the characteristics and early symptoms of shingles, the complications you should watch out for, and whether the shingles vaccine, which is getting a lot of attention now, is really effective. I'll also talk about whether people who have already had shingles should get the vaccine. By watching this one video, you'll get a thorough understanding of shingles. At YouTube Medical University, we responsibly share videos from a doctor's perspective to help you get healthier starting tomorrow. If you like, I'd appreciate it if you subscribe to the channel so you don't miss any new videos. Now, here's today's agenda. In the first period, we'll talk about the characteristics of shingles, and in the second period, I'll explain the types of shingles you should be especially careful about and see a doctor immediately. I'll introduce the dangerous types of shingles, and in the third period, I'll talk about how to prevent the painful after effects, postherpetic neuralgia. Then, in the fourth period, I'll discuss what's currently attracting attention. I'll also explain the latest information about the shingles vaccine, which may become available for free through public funding in the future, and who should get it. So first, in the first period, I'll give a simple and easy to understand explanation of the characteristics of shingles. Seeing is believing, so please take a look at this image. This is a rash caused by shingles. These are the red bumps that appear on the skin. It is characterized by quite severe pain, and you will feel a sharp throbbing pain. And actually, 1 in 3 people will get shingles by the age of 80. One of the characteristics of the rash is that it appears on only one side of the body, and as the name shingles suggests, it tends to appear in a band-like pattern stretching horizontally. If it were just the rash or bumps, that would be fine, but there's also sharp throbbing pain, and even touching it causes stinging. A burning pain. These kinds of severe symptoms can appear, and in some cases you may also develop a fever. As for the characteristics of the rash, it involves both blisters and eruptions, which means blisters will form. Over time, these blisters can burst, swell up as shown in this image, and then gradually scab over, sometimes leaving dark marks behind. So, why do these band-like red bumps appear on only one side of the body? If you think about the reason, it becomes easier to remember and harder to forget. Actually, this is caused by the chickenpox you had as a child. Chickenpox is well known for causing a fever and red bumps all over the body in children. In fact, the chickenpox virus stays dormant inside your body, and when your immune system weakens or as you get older, at those times the virus becomes reactivated and starts to multiply, causing a new rash to appear. This is what we call shingles. So, when you get older, when you're tired, when you're under stress, or when you're taking medications that suppress your immune system, shingles is more likely to appear at these times, which is a main characteristic. By the way, cold sores, the herpes that appears on the lips, have similar characteristics. These viruses are related, so they share similar traits. And the reason it appears in a band-like pattern is because it hides in the nerves. Our nerves are connected to the thick spinal cord. A single nerve extends out to both sides like this. Since the recurrence happens along one nerve, it appears on one side along that nerve. Doesn't it make more sense when you think about the reason behind it? Now, let's move on to the second period. In the second period, we'll talk about the characteristics of dangerous shingles and what happens when it appears in certain areas. If you have shingles, make sure to visit an appropriate hospital. That's what I want to emphasize. I'll introduce 2 types of such shingles. Here are 2 types of dangerous shingles. The first one is shingles that appears around the eyes. Please take a look at this image. If you develop shingles blisters like this around your eyes, there's a risk that your vision could deteriorate. So, If you have shingles around your eyes, make sure to see an ophthalmologist. By the way, it's easy to notice when it's around the eyes, but it can also appear on your forehead or brow. Shingles that appear on the nose are actually controlled by the same nerves as the eyes, so remember that you need to see an ophthalmologist not only for shingles around the eyes, but also if it appears on your forehead or nose. If you know this early, you can prevent vision loss. Please make sure to remember this so it doesn't happen to you. The second type of dangerous shingles is shingles that appear around the ear. Doesn't this image look like the facial muscles on one side of the face have lost strength and are drooping? In fact, shingles around the ear can cause facial nerve paralysis. That can actually happen. Shingles around the ear can cause such symptoms, and in rare cases, shingles can even develop inside the ear canal. So if you have any ear pain, it's important to check inside your ear as well. Shingles around the ear affects the facial nerve, so there's a risk of facial nerve paralysis, which can cause weakness in the face or even hearing loss. That's why, if you develop shingles around your ear, you need to see an ear, nose, and throat specialist. This might sound a bit complicated, but because of the same nerve connections, if you get shingles in your mouth or on your tongue, you should also see an ear, nose, and throat specialist. Proper treatment helps prevent facial nerve paralysis or hearing loss. For nose shingles, see an ophthalmologist. For mouth shingles, see an ear, nose, and throat specialist. If you don't know this, it's hard to find treatment options. At YouTube Medical University, knowledge is power. Just knowing this can protect your health. I'm sharing this important info from a doctor's perspective. I know I've said this before, but if you found it helpful, subscribing would really encourage me. Now in the third period, I'll talk about the long-lasting after effects that can occur after shingles called postherpetic neuralgia, and I'll also explain how to prevent it. Is there anyone around you who has been suffering from long-lasting pain after having shingles? If you know even one person, I'm sure you can't forget it. That's because that person must be experiencing truly painful symptoms. If the symptoms last for more than 3 months after shingles, it's called a sequela. Even though the shingles rash and bumps have healed nicely, the affected area still feels like it's burning. It hurts. It's a throbbing pain, like being stabbed with needles. Even just clothing rubbing against it causes intense pain. There are people who complain of this kind of pain. Because of this, some people can't sleep at night, can't concentrate at work, or are even forced to quit their jobs. I've seen many people suffering from these painful symptoms. In fact, postherpetic neuralgia occurs in 35% of people over 80 years old, which means 1 out of every 3 people develops this complication. So actually, it's not a rare complication, and age isn't the only risk factor. People who have severe symptoms of shingles and those who are taking immunosuppressive medications are also at risk. It's more likely to occur in those people. However, there are also effective ways to prevent it. One of them is to start treatment for shingles as early as possible. And there's another way to prevent postherpetic neuralgia. That is to get the shingles vaccine, which I will introduce next. I will explain the treatment and vaccine for shingles in detail in the third and fourth periods coming up next. Once you develop postherpetic neuralgia, the only treatment available is symptomatic therapy. Some people take painkillers, receive anesthetic infusions, or apply anesthetic creams, and if the pain is really severe, there is a procedure called a nerve block, which targets the nerves that sense pain. They numb the nerve itself to relieve the pain. Sometimes such procedures are performed, and in my experience, there were patients whose pain was so severe that they ultimately had to use medical narcotics just to get by in daily life. It's best not to get postherpetic neuralgia if you can avoid it. So, since not many people are aware of the shingles vaccine, which is one method of prevention, I will explain its effectiveness, the types and characteristics of the vaccine, and who should get it. Generally, the shingles vaccine is recommended once you turn 50. The details may vary depending on underlying health conditions. There is data showing that getting the shingles vaccine can reduce the risk of developing shingles by as much as 97%, making it highly effective. Even 10 years after vaccination, the risk was still reduced by 72%, so it's a vaccine with relatively long-lasting effects. However, the shingles vaccine hasn't become widespread because it's an optional vaccine, so basically you have to pay for it out of pocket when you get it. And since it's not a cheap vaccine, the reality is that it still hasn't become widespread. There are some municipalities that run campaigns where the price of the vaccine is cut in half for women in their area. The risk reduction I mentioned earlier is for 2 doses. The effectiveness I mentioned applies to the newer vaccine with 2 doses. Some vaccines need only 1 dose and have slightly different effectiveness, which can be confusing. I'll use a chart next to clarify the differences. The one on the left side, called the live attenuated vaccine, is the traditional vaccine that was originally used and requires only 1 dose. The one on the right side is the one I introduced earlier. The one on the right is the inactivated vaccine, which requires 2 doses. This one is newer and has higher effectiveness. However, there is a significant difference in cost between the live attenuated vaccine and the inactivated vaccine. For the live vaccine, most hospitals charge less than 10,000 yen per dose. However, for the inactivated vaccine, each dose costs about 20,000 yen, so since you need 2 doses, the total cost is generally around 40,000 yen. That's quite a difference, isn't it? So, regarding the effectiveness of these vaccines, for the live attenuated vaccine, it is said that for people over 60 years old, getting the vaccine reduces the risk of shingles by about half, or 50%. On the other hand, the inactivated vaccine, when given to people over 50, has been shown to reduce the risk of shingles by as much as 97%. There is a clear difference in effectiveness. As for how long the effect lasts, the newer inactivated vaccine is said to provide protection for about 10 years, while the live attenuated vaccine generally is said to last for about 5 years, and after 5 years, its effectiveness starts to diminish. And as I mentioned earlier, this vaccine not only reduces the incidence of shingles, but it also has the effect of preventing the nerve pain that can occur afterward. Regarding that effect, the live vaccine was able to reduce the risk by 67%. As for the inactivated vaccine, in that study, no cases of postherpetic neuralgia occurred. In other words, the risk was reduced by 100%. Let me share my opinion here. The cost is indeed high at 40,000 yen, but the effect is strong and lasts a long time. One way of thinking is to go ahead and get the inactivated vaccine twice. However, the price is completely different, so first, the effect lasts for about 5 years. Should you get the live attenuated vaccine now and then get it again in 5 years, or switch to the inactivated vaccine? Or, as I will introduce later, maybe in 5 years the shingles vaccine will be publicly funded and free. That's also a possibility. So I hope you will consider which vaccine to get based on your own way of thinking and after considering your budget. By the way, regarding side effects, the inactivated vaccine, which requires 2 doses, is more likely to cause fever and pain at the injection site. Please take these factors into consideration as well when making your decision. Actually, as of July 2024, the Ministry of Health, Labour and Welfare is moving toward making the shingles vaccine publicly funded, in other words, free of charge. The timing hasn't been made clear yet, but there is also a movement to make this vaccine free, not for those over 50, but for those over 65. I'll make a video when new information is available, so please subscribe to the channel to stay updated and not miss any videos. Because this vaccine is expensive, costing between 10,000 and 40,000 yen, I hope it becomes free soon. Now, let's review what we've covered so far. Shingles is a condition where 1 in 3 people over the age of 80 will get it, and it causes painful red bumps to appear on one side of the body. And this happens when the virus that caused chickenpox in childhood becomes active again. Also, there are dangerous aspects to shingles. That is shingles that appears around the eyes or ears. In such cases, I explained that it is important to see an ophthalmologist or an ear, nose and throat specialist. And shingles can have painful after effects. This is called postherpetic neuralgia. These symptoms are pain or tingling that lasts for more than 3 months after having shingles. It's a stabbing or burning pain. 1 in 3 people over the age of 80 experience this. People with severe symptoms or those with suppressed immune systems are also more likely to develop it. And to prevent these, it's important to start treatment early. I explained that the shingles vaccine is effective. I also introduced that there are 2 types of shingles vaccines, the live attenuated vaccine and the new inactivated vaccine. Because the cost and effectiveness differ, please comment if you choose either option or skip vaccination altogether. I'd like to know your thoughts. I think your comments will help others make their decisions. So finally, I'd like to talk about the questions I often get from patients when I diagnose and treat shingles in my clinic. I'll explain these questions in a Q&A format. The question is, what kind of treatment is there for shingles? Here is the answer. Generally, the treatment involves taking oral antiviral medication to suppress the shingles virus. By taking it for about a week, the treatment is completed. And it's important to take this antiviral medication within 3 days after the onset of symptoms. That's what is said. It's believed that the medication is effective when it suppresses the virus as it starts to multiply. So it's said that taking it after too much time has passed won't be effective. By taking it within 3 days, it's said that the rash heals better and it helps prevent postherpetic neuralgia. For example, even if shingles appears on a Friday, if you wait until Monday to see a doctor because you're busy today, 3 days may pass and your symptoms could get worse. So it's very important to go to a hospital as soon as you notice the symptoms. Because these are medications, side effects are possible. The medication for shingles puts a strain on the kidneys, so we adjust the dosage according to kidney function when prescribing it. And this medication is still expensive. Compared to regular medicines, just 1 week of treatment usually costs several thousand yen. It's an effective drug, so I really want you to take it, but those are some of the considerations. I also want you to know there's a cost disadvantage. Here's the second question. The question is whether the symptoms of shingles appear at the same time. In many cases, pain appears first, and then a few days later, a rash or bumps on the skin may develop. So based on my experience, sometimes patients say, "Doctor," they come in complaining of stomach pain, and after running various tests to find the cause of the pain, we can't find anything in particular. So maybe a few days later, red bumps appear, and then we realize it might be shingles. I told the patient to keep a close eye on that area of skin, and if red bumps appeared, it could be shingles, so they should come in right away. As it turned out, the patient checked their skin every day, so they were able to notice the shingles early and start medication right away. Many people actually have trouble noticing rashes or bumps on their skin, even if they feel pain, unless they make a point to check areas like their back or legs. Also, sometimes the rash appears after the pain starts, so please make sure to check the painful area every day using a mirror or something similar. Next question. The question is, can shingles be transmitted to other people? This is something I'm often asked, and the answer is, in most cases, no. As I mentioned earlier, shingles is simply the reactivation of the chickenpox or varicella virus, so it's not something you catch from others, but rather something that comes from the virus you already have in your own body. Please understand that it's the virus becoming active again. However, the virus that causes shingles is the same virus as the one that causes chickenpox, so people who have already had chickenpox won't get infected with the shingles virus. However, for those who have never had chickenpox, children or adults who come into contact with someone who has shingles can develop chickenpox. That's why infection control is important. For households with children, ensure kids don't touch the shingles area and avoid sharing towels to prevent spreading the infection. Try to take a bath last if possible. Basic infection control measures like thorough hand disinfection are very important. Next question. If you've had shingles once, you don't need to get the vaccine, right? I often get asked this kind of question. And there are also people who mistakenly believe, as a superstition, that if you get shingles, you won't get it a second time for 3 years, but that's not true. Even if you've had shingles once, there's always a possibility that it could occur again at any time. If you gather 100 people who have had shingles, statistically, about 1 person per year will have a recurrence. So, as I keep saying, there's always a chance it can come back at any time. Even if you've had shingles before, the shingles vaccine is definitely effective. Of course, it's not a cheap vaccine, but if the pain was severe and you never want to go through that experience again, I think it's a good idea for people like that to get the shingles vaccine at any time. This is the last question. I often get asked, if I get shingles, what kind of doctor should I see? To give you the conclusion first, if you have a regular doctor or someone you feel comfortable consulting about anything, I think it's fine to talk to them first. Shingles is a fairly common illness, so there are many doctors who can diagnose and treat it, whether they are in internal medicine or not, especially if you don't have a regular doctor. For those people, if you're wondering where to go, basically dermatology is the specialty, so it's a good idea to see a dermatologist. And for those who suffer from postherpetic neuralgia or long-lasting pain, pain clinics can also be a strong ally. In many cases, people are referred to these clinics But if you are suffering from pain, a pain clinic like that is an option. I think visiting a clinic that specializes in pain is also one option. What do you think? This time we've covered everything you need to know about shingles. We explained the characteristics of shingles, the risks of the shingles vaccine, and the after effects in an easy to understand way from a doctor's perspective. Please let us know about any symptoms you or your family and friends have experienced. Your input could be helpful for others, and whether it's a thumbs up or a thumbs down. If you could rate this video, it will help us improve our next videos. Here at YouTube Medical University, we focus not only on treatments for illnesses, but also on prevention methods. We share this information responsibly, using data to support our explanations. I believe it's very important to have at least one reliable source of information so you can live a healthy and fulfilling life, even in the later years. If you like, please subscribe to the channel and check out our new videos. I'll see you in the next video. As a general practitioner, I want to share how my patients live agelessly after their 70s. It became a bestseller in 4 categories on Amazon and ranked #1 in the gift rankings. I've compiled into one book the important ways of living and health methods that I've learned from my patients while working as a doctor. It's a book that will make you think, I want to live a healthy life like this too. It's on sale now and getting great reviews, so please check it out.